Hi, I'm Madeline, Communications and Government Affairs Lead for Pathology Technology Australia, and I'm here with Deidre Mackechnie. She's the CEO of Australian Patient Advocacy Alliance. Welcome and thank you for joining us, Deidre.
Absolutely my pleasure. It's a delight to be here.
Today, we're going to delve into all things advocacy, but I'd like you to start by telling us about APAA. Who makes up your alliance? How many patients do you represent? Can you give us a bit of your origin story?
Absolutely. The Australian Patient Advocacy Alliance arose out of a collective of CEOs who, representing patient organisations, who started to see that there was quite a bit of merit in working together to advocate for those issues on which we shared common goals. It started uh, just over 3 years ago, but really we've sort of existed for about 2.5 years legally. We started with 20 patient organisations, which has grown over the last couple of years to 42 patient organisations. So there's been incredible growth, which is a real indication as to the need for this kind of alliance and the desire for collaboration. Our focus is on people who are living with chronic and complex disease. We represent those peak patient organisations that represent 12 million Australians living with a chronic or complex disease.
Wonderful, wonderful. And you've worked in advocacy for some time now, for individual organisations. How does what you do now differ from those sorts of arrangements?
It's a really good question, and it differs in both positive and negative ways. The positive ways are, of course, there is strength in numbers. If you can approach the decision makers and say that you represent 26,000 Australians, they'll listen to you and they'll consider your case. But if you front the decision makers and say, I represent 12 million Australians, then you've really got their attention. So I think that the power of the number is actually really valuable in working with decision makers. The negative is that it can sometimes be a bit scattered and a bit like herding cats. So trying to get 42 CEOs to agree on advocacy priorities can be a challenge, although has actually been a lot more straightforward than I would have anticipated. And also you can sometimes get tempted to delve into the specifics, which of course, when you are representing a disease, is very appropriate to do. You dive into the things that are specific to your disease condition, but that is the job of those individual peak patient organisations. It is not the job of a collaborative alliance like ours. So some of the challenge is actually stopping me from jumping in and helping, well intended, but trying to hold back and thinking, no, that's not our job. Our job is where there is consensus of view.
Yes, absolutely. And I think we experience something really similar here at PTA. Being an industry representative body, we're also an alliance of sorts. Not only are we looking for synergies across all of our member organisations, which in this case are the manufacturers and suppliers of diagnostic tests and technology that's used in pathology labs, hospitals, even at home. And this is the sorts of technology that help patients every day. We're also reaching out to stakeholders across the healthcare landscape to collaborate and connect to find synergy in our messaging and an advocacy that will shift that dial towards better care for patients at a lower cost to the economy, which is what the powers that be are looking for. How does this align with the sorts of key points in your advocacy activities?
Yeah, look, it's a really interesting thing. I think one of the things that we learned from our experiences in the pandemic is how inextricably linked health and the economy are. It's not just about health expenditure, it's about spending money in a way that ensures a healthy Australia, which keeps people employed, keeps people engaged in their community, keeps people paying taxes, and stops them from accessing some of the supports that the government provides that if they stay well, they don't need to access. And so I think it's been a really interesting lesson for us to learn, but it's also been a really strong pillar of one of our advocacy priorities, is to continue to seek the government investing in health in a way that sees them recognising the overall impact. So it's not just about spend, and they still talk about it, health expenditure. So they see it as a cost to the economy rather than an investment in the economy. And I think that that's one of the things that, particularly in the area of pathology technology, that the impact of early diagnosis and therefore early treatment and therefore reduced impact on the person living with a chronic disease can have a really positive effect on that individual, but also on the economy overall. And that's part of what we're really pushing for, and why we're really keen to continue to work with your organisation around trying to progress some of that work.
Yes, absolutely. And we really value that collaboration. When it comes to the advocacy activities that you do, where do you see your biggest challenges? Or I guess we could flip that around and say, what is your ideal scenario when it comes to working with or interacting with other stakeholders in healthcare or the wider community?
Look, it's a really interesting question. I think the greatest strength we have at the moment is that there is an incredible appetite for change across the whole sector. Everyone sees that. We had this amazing system set up 40 years ago that at the time was fit for purpose. But what we've seen is that society has changed, and most importantly, medical technology has changed, and so therefore we no longer have a system that is fit for purpose, and most people recognize that and are looking toward that change. So that's the positive, and that's the strength behind some of the work that we're going to be trying to do. The challenge around that is that when you've got something as big as the Medicare system and all the things that hang off the Medicare system, it's like trying to turn the Queen Mary around. It is not something that you can achieve in a really short space of time, because there's a lot in it. It's an incredibly complex system, and it's been going for a long time. And so that's part of our challenge, is how do you change it? What we're seeking is for the government to create a long-term vision. So to actually think about, what should our healthcare system look like in 10 to 15 years' time, because that's how long it's going to take to change it. But what should it look like in 10 to 15 years' time? And how do we start the process of working toward that? So what we're seeking is not bits and pieces of change now that might be quite good ideas and might be quite worthwhile to do, but are not working towards that really long-term goal of truly revolutionising and the healthcare system. So we're looking for that long-term vision that transcends an electoral cycle. And that's the biggest challenge, is because, of course, decision makers that we are dealing with are, keen to change the system, but also keen to get elected back in next time. So getting them to do something that's going to make them look good in 15 years' time isn't that palatable. So it's about how we work together to achieve that vision, but how we can also get some wins along the way so that they can continue to be that representative voice for the Australian population.
Brilliant, brilliant. We're looking for that vision as well, so we're right there with you. It's been an absolute pleasure speaking with you today. Thank you so much for taking the time to join us. You really are doing some incredibly important work, and you're bringing the voice of millions of Australians to the table. We support those efforts and champion for this positive evolution, for this vision of healthcare. And I want to say, do you have any other thoughts or comments that you'd like to leave us with before we leave today?
Look, the main thing is, I think we had an idea a couple of years ago that working together collaborative as patient organisations had some merit. What we've certainly seen is that absolutely it did. But what we've also seen over the time is the incredible strength in working with other organisations, working with the pharmaceutical industry, working with the pathology technology industry, working with other patient voice organisations to achieve that change. So finding those ways, finding that common ground that we can all work together has been sometimes a bit of a challenge, but most of the time incredibly rewarding and incredibly fruitful, in that we actually do share that vision that the healthcare system can actually be world class and can change, just not overnight.
Brilliant. I love that. Wise words, and that olive branch is being extended to all. So reach out and grab it. Thank you so much, Deidre.
Absolutely my pleasure.